and I researched treatment strategies for the bilingual individuals with Aphasia. Defining a bilingual speaker. Bilingual speakers are those who speak 2 or more languages on a daily basis. According to the U.S. Census Bureau, bilingual individuals are one of the largest growing populations in the United States. 47 million people age 5 or older speak a language other than English at home. Strokes are the primary cause of aphasia. Risk factors for a stroke include diabetes, smoking, obesity, high cholesterol, and a sedentary lifestyle. Latinos are twice as likely to develop an ischemic stroke due to inactivity, obesity, and diabetes. Clinicians can play a role in educating individuals within this demographic by providing education on the risk factors associated with this condition. Several things make working with aphasia and the bilingual speaker a unique situation. Research shows that while different languages share many neural areas, they are not entirely identical. This makes the decision of which language to target during therapy a tricky one. Also, all languages are not equally damaged following injury. Possible factors influencing language recovery include the amount of input from each language following injury, emotional experiences in each language, and language use after injury. Also, various recovery patterns are seen in bilingual speakers. Several tests have been developed to assess bilingual aphasia specifically. Major tests include the Bilingual Aphasia Test, or the BAT, Multilingual Aphasia Battery, Aphasia Examination Spanish version, and the Western Aphasia Battery, Spanish version. Once assessment has taken place and the clinician is ready to begin setting targets for intervention, Asha has outlined some important points to consider before beginning intervention. How many languages does the client speak? When did the client learn English or their secondary language? When and under what conditions does the client use each language? And what is the client's prognosis? As mentioned before, recovery patterns in bilingual speakers are not entirely identical. Recovery patterns could be parallel recovery, in which the recovery of languages parallels premorbid abilities, differential recovery, in which one language is recovered better than the other when compared to premorbid abilities, antagonistic recovery, in which one language is initially accessible, but as another language recovers, the previously used language disappears, alternating antagonistic recovery, blending recovery, selective aphasia, in which language loss occurs in only one language, and successive recovery, in which the recovery of one language occurs before the other. The same approaches used on monolingual clients have been used to treat bilingual clients. However, these approaches are not evidence-based approaches, but rather based on empirically validated theories. The following are some of the approaches that have been used with bilingual individuals. The general stimulation approach is an intensive auditory stimulation, repetition, naming, and writing tasks at varying levels of complexity. Phonemic cueing, providing initial sounds in order to facilitate word retrieval, and use of the cueing hierarchy. Other treatment approaches like melodic intonation therapy or using music like intonation and rhythm to help in word and speech production have been used with success with monolingual patients, but no research exists proving efficacy with bilingual patients. General intervention principles for individuals with aphasia include choosing attainable language targets, use of multiple modes of stimuli, deliberate and gradual increase in complexity of language tasks and stimuli, and the choice of intensity over duration. In other words, therapy conducted for fewer days but with longer blocks of time is more effective than therapy conducted for fewer hours at a time over many days. Specific intervention principles for bilingual speakers with aphasia Research shows that cross-linguistic generalization is best when intervention targets use shared aspects of both languages. The use of cognate therapy has been shown effective. Cognate therapy approach is based on the possibility that the two lexicons of a bilingual speaker may be functionally and neurologically interconnected, which should allow across as well as within language gains. In this therapy approach, you would target words that share an etymological origin, such as night, nuit, nacht, noche. Intervention strategies should reflect characteristics of the language being targeted. Cueing strategies may vary from Spanish to English because of the existence of gender marking in Spanish. Also, special considerations should be taken for use of compensatory strategies. Speakers often use one language to cue another by producing the target word in one language to help cue production in the other. Deliberately teaching this strategy along with the use of cognates could be very helpful. And lastly, goals treating bilingual patients should be based on their pre-injury language proficiency. For example, target reading only in the language the patient read in pre-injury. Some special considerations when working with translators is to be sure to use a professional interpreter. Meet with a translator before assessment or intervention to discuss goals for the upcoming sessions, materials to be used, protocols to follow, and any speech and language disorders present in the client. Refrain from using technical terms. And very importantly, during the therapy session, the clinician should directly address the client and be sure to maintain eye contact with the client, not the interpreter. Aphasia will present great challenges for the patient and their family. These changes are sudden and range from financial strain, shift of household responsibilities, care for children, and of course the care for the patient. So what types of things can an SLP do to help a family living under these conditions? They can help them focus on coping strategies, suggest joining a self-help group, educate the family on the importance of simplifying sentence structure when speaking to the person with aphasia, involve the family in the evaluation and treatment process, and encourage the family to continue to involve the patient in family decision-making as much as possible. Here is an example that Yaile and I found of a clinician working with a bilingual individual with aphasia. I'm sorry, I think our internet connection is kind of slow.
¿Estás listo?
Ah, sí.
Ok, vamos a empezar entonces con esta aquí. ¿Qué es eso?
Es una Jane.
¿Otra palabra? Una
Afeitadora.
eso, una afeitadora. Hector had a gunshot wound to the head. He now has difficulties with language, so something we call aphasia.
The doctor told me, I got a stroke. So it's like, you have to learn how to talk. I have to learn all over again.
¿De qué te recuerda una afeitadora?
2 días. Porque yo tenía una pimple. So, y no puedes porque...
No puedes.
Our goal is to develop therapies for individuals with bilingual aphasia. The way we're trying to do that is by providing therapy for the weaker language.
He is stronger in English now than he is in Spanish, which is his native language. So something that he really wants to work on is improving his level of Spanish. So we have a group of 10 pictures, and with each picture, he's asked to identify it in the hopes that it will strengthen the semantic network in his brain so that that word will become more easily accessible. Tocador. No te recuerda de qué.
No me recuerda en el mundo.
So dijiste que tocador no te recuerda del mundo, de un cumpleaños y vidrio. Bien.
If I told you that a canoe is a small-sized boat that goes in water, that one person can sit in, that information stays longer in your brain than if I just said canoe.
All of those things trying to strengthen the connections to that word in his brain so that he can retrieve it. ¿Y cómo se llama esto?
Tocador.
Es muy parecido la palabra. He still is focused a lot on the way words sound. So tocador and afeitadora, at the end of that word, it sounds really similar to him. And so something about that similarity, like phonetically, makes it very difficult for him to access the right word. ¿Para qué se usa? Para...
Como afeitadora. Afeitadora.
Exacto. So piensen, ¿para qué se usa?
Afeitadora.
Ajá, muy bien.
So we assess our patients' progress every week for when we'll stop therapy. So almost all patients we see in therapy have to improve by a certain amount before we say that the therapy is effective.
Like 3 weeks now I'm learning English, but more talking in Spanish.
You can see that he gets really excited when he remembers a word that he knows he's had difficulty with.
Una afeitadora.
Exacto, otra vez.
Afeitadora. It feels good, you know. I'm still here, you know. I'm a survivor.
Research indicates that there is no single approach to treating bilingual individuals with aphasia. Since this area lacks high-level research evidence, clinicians combine therapeutic approaches, having solid research base in other aphasia populations in order to best meet the needs of their bilingual clients. Again, there is a significant lack of evidence-based research in this area. Most studies are weak and consist primarily of case studies and small group designs. Insufficient data to support which language a clinician should target, L1 or L2. However, recent research has indicated that it is best to target L2 initially. Further research is needed to determine which aspects of languages are most vulnerable. Further research is needed to determine the most effective treatments. And here are some of the references that we used.